Okay, we'll go ahead and get started. Once again, for those of you just getting settled, my name is Leanne Foster and I am a provider outreach and education specialist here at WPS. I would like to welcome you all to our Getting Started with PECOS Access. So PECOS is our provider enrollment chain and ownership system, and it is the system that is utilized to submit electronic enrollment applications. So you're going to hear me say that acronym quite a bit today. What our goal is today is to help providers that maybe are unfamiliar with PECOS, unfamiliar with getting set up with a user ID and password. We want to navigate you through what's referred to as the identity and access system. You're going to hear me use the acronym I&A a lot today as well. So our goal is to provide you with an understanding of how to register through for PECOS through that I&A process. So to accomplish that, we're going to talk about a few things. We're going to go through some I&A system overview basics and some resources that are available to you to help you with that. Those resources are going to include a user guide and actually an FAQ that'll help you through a lot of the most common scenarios. We are going to walk you through how to create a PECOS account using that I&A system. And while I can't, for security purposes, I can't go through the live system, I do have demos that I built in through screenshots that will take you step by step through that. We are going to spend some time talking about roles and permissions. We get a lot of questions on that, particularly with regards to surrogacy. So we're going to talk about how to make those connections, the surrogacy connections. We're also going to talk about the user roles and what they have permission to do inside that I&A system. So I'm going to start with an overview of the I&A system. There is confusion, and we often get questions about the difference between the I&A system and PECOS. So I want to start there. The I&A system is not PECOS. You cannot submit enrollment applications through it. What that I&A system is it's a repository for all user data, and it's a repository for multiple systems, specifically to CMS and our purposes here. It's going to manage all user access data for PECOS, but also when you get your NPI, it's going to manage the user ID and access for MPES. And I point that out because if you or you represent a provider who has access to MPES, you already have access to the PECOS system. MPES and PECOS use the same user ID and password. That reduces the provider burden a little bit. There's also only the one enrollment system. Now there are a couple of other systems that you may hear or see on the website when you go to register through I&A. Those are Pepper and CBR. Those are not systems that we'll be talking about today, but this is a system that's used for managing that access. And that's going to include that user ID, that password, contact information, and it's also going to be how user permissions, that user data is managed. As we get further into this, you'll see we'll talk about authorized officials in I&A, and we'll talk about the different user roles. Staff users, surrogates, and connections, allowing individuals that are not the provider to manage their enrollment data on their behalf. That is all managed inside I&A. You have to get that permission before you can access other providers' information. So with that in mind, the functions, as I mentioned, it manages the access for MPES and PECOS. So if you have access, user ID access to one, you have access to the other. It is used specifically for new users, but it's also, again, existing users. And it includes some self-service tools, including if you forget your password, you forget your user ID, that system is going to be where you would reset all of that. And I point this out because it's happening systematically in I&A. User IDs and passwords are not something that your Mac, us, WPS, or other Macs, it's not something that we have control over. This is a CMS system, so it is something you'll want to use your self-service tools for, and we'll talk about that a little bit more. I do want to take a minute to talk a little bit about what the I&A management system does not do. We get questions on this quite a bit. We will get questions about, I updated the authorized official in I&A, but my enrollment record hasn't updated. So I&A and PECOS, so PECOS is where the enrollment record is, I&A is where the user ID information is, password information is. I&A does not manage any of your enrollment data. So you may be using the same authorized official information in the I&A system that is also on your enrollment record inside of PECOS, but you cannot change that information from I&A. If there is a change in your authorized official, and one of the questions that we received was to define that authorized official. An authorized official is someone that can enter an organization into a legal binding contract. So the enrollment applications are considered contracts. That authorized official is going to be a high-ranking official that has kind of that ultimate control over that organization and can sign contracts and represent that organization. They again may be the same in both systems. However, if that changes, you will have to change that information in I&A for the user access purposes, but you would also need to update the enrollment record if that is also impacted. And to do that, you would need to submit an enrollment application. I&A and PECOS do not talk in that way. Again, just for that access. Same thing with address information. Contact information will get changed inside of I&A, and we'll get calls saying that I changed it there, but it's still incorrect on my enrollment record. And that is because, again, that information does require an application. They're separate, separate CMS systems, and that is intentional. The other thing that I&A management doesn't do is it doesn't manage staff in terms of reassignments, so providers. It's not managing PTANs in any way, shape, or form. It's just managing those that can submit applications to manage that information. So next, we do want to talk about user types, and there are multiple user types available through I&A system. And they include the individual provider, which is, we'll talk about the definitions here in a second, but the individual provider, the authorized official, someone who is an access manager, a staff end user, and a surrogate. Now you are going to see some similarities in these, and I do want to walk through these because the other thing that is different is what each role or each user type is able to do. I also want to point out that it is possible for an individual to have different roles for different organizations, and it just depends on what their relationship to that organization is and what that organization is allowing them. So we'll start with individual provider or supplier. This one's really straightforward. This is the provider that is going to be billing for Medicare. This is going to be the physician or that non-physician practitioner who holds that MPI and is actually providing those services. Now, even when someone is acting on their behalf, these physicians or non-physician practitioners are going to have a user ID and password inside of I&A, even if they are not submitting their own applications. Remember, I said that this is also the user ID and password that's used for the MPES system when they get their MPI. So they're going to have that at some point. They may not use it a ton, but they are going to have it. If you have a solo provider, that's another situation where they would be using both it for MPES and for PECOS. The next is going to be an organizational provider. That's going to be the group practice or the hospital supplier, or it could be another medical supplier, maybe an ambulance service. It could be a clinical laboratory, but that's going to be the entity itself. Like the individual provider, those groups, those organizations, those Part A hospital facilities, they are going to need an MPI in order to bill Medicare, and so they are going to have user ID and password access set up or have to go through the I&A system in order to get that MPI and in order to enroll in Medicare. The other type is going to be a third-party organization. This is going to be your billing agencies, your credentialing consultants, your staffing company. These are going to be entities that have a business relationship with that individual provider or those organizations, not necessarily staff of those organizations, but they have a business relationship to perform certain tasks, and often that's going to be the claims billing and also the credentialing. Next, we have authorized official. I talked about this just a little bit in the fact that an authorized official has the authority to legally bind the organization into legal contracts. They can make decisions on behalf of the organization. So that's typically where we're going to have the authorized official, is where you have those group, those organization, and those inpatient facility user ID and passwords. Again, it could be the same as what's currently listed in PECOS. It may not be the same. Typically it is. Uh, you're in PECOS, the difference could be you could have multiple authorized officials depending on the setup of that organization. This is also going to be different than a delegated official. Delegated official is something that is unique to PECOS, so we're not going to touch on that piece, but authorized official is a common terminology that's used for both PECOS and I&A. Again, they could be the same person, they may not be, so it's going to be super important that you know who's actually in charge of I&A versus PECOS, or if they're in charge of the organization for both. With an authorized official, they have quite a bit of power, if you will. They have a lot of things that they can do. They can initiate user ID and passwords. They can also accept and manage access of both staff users, so those would be direct employees of the organization they're the authorized official for, or surrogacy connections. And that's going to be where you have that third party that has that business relationship. So again, a credentialing consultant or a billing agency. Could be a staffing company. Then there's also an access manager. Now, they won't have necessarily the title of delegated official, but this could be a delegated or authorized official that has oversight of the organization on their enrollment application. And I throw it here so that you understand that they're not necessarily going to be set up as a delegated official, but they'll be set up as an access manager in I&A, and again, could be the same people. So you can have multiple people that can manage that access as you start adding staff users and surrogates. So let's talk about those users and those surrogates. What are they? What's the difference? And the answer is not a lot until you get to what they can do. So they are obviously not going to be that authorized official. They're not going to be the individual provider. They are going to have a relationship to the provider. So a staff user is going to be somebody who is directly employed by that group, that organization, that facility. So here you want to think inside billing staff, inside credentialing staff. They work for the facility whose applications they directly work for the facility whose applications they're going to be submitting, manipulating, and correcting, things of that nature. You can enroll as a staff user, but it does require approval, and we'll show you how that happens. But it does require approval. So you can enroll, you can say, I need to be a staff user for this organization, but you're not immediately going to have access to submitting applications or seeing that group's enrollment data. That information does need to be approved by that authorized official or that access manager. Okay. Once you have that access, you are going to be able to view and modify approved enrollment connections. So you can see the enrollment records if you have to do a revalidation. You're going to be able to see the information you need to submit an initial application. You're going to be able to see reassignments on an organization. You can submit for changes. So once you're set up, there's quite a bit that you can do. A surrogate user is going to have some of the similar abilities, but a surrogate user is going to be an organization with a business relationship. Now, this can be a couple of things. It could be an individual provider who has a business relationship with a medical group, not working for them, but maybe they have a relationship with that medical group to do their billing for them, but they're still practicing independently. It's a little less common, but we do see that. It also is, again, that credentialing consultant, those billing agencies or those staffing companies that we mentioned, that they are contracted to perform a service for that provider, that organization. They are still going to need that approval before they can start submitting or viewing information. But once they do, again, they're going to see they have the same abilities as a staff user. They're going to be able to access, they're going to be able to view and modify records on their behalf, but they do have to have that business relationship and they are going to be that third party organization. So again, not a lot of differences, but they're different roles so that CMS can see the difference between the users, whether they are directly employed and work for that clinic inside, or if they are a third party company that has a business relationship. And here I have included a chart. This is something that CMS does have posted, and I'll show you that in a minute. But this is going to show you the different roles, and it's going to let you know if you can represent an organization. That first column, that represent an organization, is going to be more of that authorized official, that access manager role. So when it says no for staff, end user, or surrogate, it doesn't mean that they're not able to do anything with their applications, but they're not going to be signing initial facility or organization or group enrollment applications. They're going to be able to manage or edit applications and enrollments for existing providers or start new members because that's considered more of a change to that group. So then managing staff, that means that access, they're not going to be able to manage that. They're not going to be able to remove access from existing staff. An access manager, an authorized official, the individual provider, they're going to be able to remove access as they see fit. It isn't something that needs to be requested for removal, but they're going to have control over the staff that they have. They're also going to be able to approve and manage any connections, and this includes surrogate connections. The staff end users and the surrogates do not have access to manage their own access, their connections to other providers. Again, they're acting on their behalf, so they need that approval. But then acting on behalf of the provider and CMS systems, this is going to be those applications, they're going to be able to do that. Now there is that identity and access quick reference guide, and I've included a link, but I want to show you where that is. And you're going to access that from PECOS. I'm going to go in from the CMS website, and under Medicare, Enrollment and Renewal, to Providers and Suppliers, Medicare Enrollment for Providers and Suppliers. And if you go into PECOS, you're going to see a section on the right side that says Register for a User Account. That, or if you're an existing user, when you're inside, it's going to have a link for you to manage your existing access. That'll take you into I&A as well. And we come here, and there's just a few warnings, because on the I&A homepage, which is what this is, you will scroll down to the bottom, and there is a quick reference guide. This is a really good tool, a really excellent resource, especially as you're setting up for the first time. It does give step-by-step instructions. There are some screenshots. There are some resources. There's also an FAQ that we'll talk about a little bit later, but it talks about the user. What you're going to see here is that same chart. It's under what you can do, but it talks about what those user roles are and what they can do inside PECOS. The other thing that I have included here are just a few examples of organizational setups that we see. The one in the top image on the left where you see Joe Brown and Sarah, this is going to be where you have an individual provider and they have an employee. That's going to be an example of a connection where it's going to be a staff user. Surrogacy doesn't come into play here. They have an in-house biller or in-house staff that are going to be manipulating their enrollment information, and they would set themselves up as a staff user. And we'll show you how to do that in a second. If you're going to the right, so that top image on the right, this is going to be a situation where we start talking about surrogates. And surrogates is definitely one of the more common situations that we see. But here you have an individual provider that has a connection with billing medical, and they're having a connection with that billing agency, and that agency has staff. While those Billing agency staff are staff. They are technically surrogate users to Joe Brown because they do not have a direct employment arrangement. They have a business relationship. Going down to the lower left image, this is going to be just a little bit more complicated. This is going to be an organizational provider. As you can see, Jane Foster, they do have a connection. That's their authorized official. That authorized official is directly tied to that organizational provider. The authorized official is never going to be someone from that third party company. That's always going to have to be somebody that is part of that organization. That organization has a business relationship with billing medical, so staffing agency, billing company, credentialing, consultant, whatever the case may be. And then billing medical has two staff members. Now, they do have an authorized official as well, but they are going to be set up as surrogate users for the health product store, which is that organizational provider. Again, they are employees of the entity that has the business relationship with that organization. And then the one on the lower right definitely gets a little bit more complex, and these are certainly just examples to help you along the way. But you have a provider who has a health group connection, and that health group is their employer. So they're reassigning benefits to that employer. Now, those that are working for that health group, maybe they're in the billing office, they would be staff users because they are directly related to that provider's employer. They all have a direct connection through that health group incorporated, but they may also have a business relationship with billing medical, and billing medical may also be doing some of their credentialing, maybe doing some of their billing. The billing medical staff would be submitted and created as surrogate users. So there's levels to this, and it's all about that relationship. The employees of Health Medical Group and the surrogates for billing medical, they have a lot of the same abilities. They basically have the same abilities. However, they'd be represented different in the system for CMS. And there are a few more of those examples inside of that user guide, but they're there to help you understand how your setup would play into requesting access. So let's jump into using the I&A system. So you just saw me access the I&A system through CMS. That was, I'm just going to go back one screen. You would access it through PECOS, but what you're seeing here are the same things. It does give you a warning when you leave PECOS that you are leaving PECOS and you're going to the I&A management system, and it's asking you to accept different terms and conditions. I do want to point out this is going to look fairly similar to the PECOS user ID or login screen, so you want to make sure you know where you are, but your access for this is going to be the same as PECOS. But make sure you're looking at the top because it will tell you which system you're trying to access. So you are going to register for a user account, you are going to accept those terms and conditions, and that is going to bring you to that login page that we just went into. So from here, you're going to see item A, and that's the sign-in. That's the user ID and password. Now, if you need to create an account, if you do not have one, I'm going to jump ahead to item D on this image. You will need to click on Create Account Now, and we'll show you that in just a second. Item B, you're going to see is going to be that self-service information, where if you've forgotten a password, if you need to retrieve a forgotten user ID, that's where you can do that. Part of the setup will also give you the option to set up a PIN. So if you want to enter a PIN to confirm access as part of MFA, you can do that. That is all there as well. So if you forget your user ID, if you forget your password, that is something, again, you are not contacting your Mac for. We do not have access to that system. That is something that you'll want to use your self-service tools for. And then at the bottom, item C on that left-hand image, you will see the quick reference guide and then the frequently asked questions that's out there as well. And I just want to show you that. So we went into the quick reference guide, but this frequently asked questions, this does get updated periodically. Looks like it was updated in January. That's what that footer will tell you. But they do go through this, and they have different scenarios, from access to the system's not letting me accomplish something. Why won't it let me see, uh, access this role, or won't let me see this provider? That information is in here. So once you do the create the account now, if you sign in, enter your user ID and password, it's going to take you into the system, and we'll show you what that looks like in a second. I do want to take a little bit of a detour here and go to create an account. The next screen that you are going to see is going to be the user registration page. Now there's a couple of things to keep in mind here. You're going to need an email. It's going to ask you to confirm that email, and then it's going to have you do one of those images, type what you see, CAPTCHA type of things, just to confirm that you are indeed a human. That's a pretty typical part of our everyday life with our virtual world. And then again, you're going to have continued access to the quick reference and the frequently asked questions. The system wants to support you every step of the way. So let's take a closer look at that user registration. So to start your registration, as I said, you're going to need an email. You're going to need a unique email for each user ID and password. So if you have multiple staff, they all need a user ID and password. You're not going to want to, your best practice isn't going to be to utilize a shared mailbox. They will each need to use their individual mailbox. Once you get in, they are going to be able to add additional email information into their profile for contact information, but to set up their user ID and password, they are each going to have their own information. It will also require you to complete security questions. They are required. We do use these as verification when there is a password reset. You're probably familiar with this with other systems where you go to reset it, it may send you a code, it may ask you a series of questions, and that is again that identity verification, because all users in here are going to need to have their own user ID and password. So this is, once you enter that user ID, that unique email in there, that password, it is going to ask you some information about yourself. So it's going to ask you your name, it's going to ask you for date of birth, it's going to ask for social security number, again that secondary email address that I just mentioned, and then it's going to look for contact phone numbers and addresses. And this is needed for CMS's user validation purposes, and again each user needs to set up their own user ID and password, and we need to know some information about them because of the information that they'd be gaining access to this as we set up the connections. So you do need to fill out all of the fields with the red asterisks. Those are going to be the required fields. Really, if you look here, the only fields that you don't have to fill out are things like middle name, suffix, that secondary email, and an address line too. So basically you're filling out all of those fields. You do have 30 days to complete these. Now typically this is something I would recommend just do it right away, but if for some reason you get pulled away as you're starting this, you do have 30 days before it has to be completed and you wouldn't be able to gain access. Again, this is going to be information that's separate from PECOS. I talked about how I&A doesn't update PECOS. This is the contact information that we'll get questions on. Why hasn't it updated on my enrollment? This doesn't cross over. I&A and PECOS do not talk, and that is intentional. That address is also going to need to be a valid address. It is something that the system does verify with the United States Postal Service, so you want to make sure that you are giving us a valid contact information. So user security, this is going to be now where you will choose a user ID. It does not have to be your email address. I know in our everyday lives there's a lot of systems that just use our email address. You don't have to do that here. You could. I don't know if there's necessarily something typical for most providers, whether they're using their email or the user ID, there are a couple of things to consider as length. That user ID cannot be more than 12 characters long. It does have to be at least 6. So, and you'll see the rules there. I know they're a little fuzzy on this screenshot, but as you're in the system, it's going to show you that. And then those user guides will have that information as well. You will then select a password. That is also going to be something that does need to be 8 to 12 characters long. It does have to be alphanumeric. It does need to include a capital letter, and it's going to need special characters. So again, those rules are there, and you'll see those red X's. They'll turn to green check marks as you meet all the rules to let you know that it's a good password or secure password. Then you are going to get 5 security questions. You'll see that they are drop downs. You do need to select from the list. It's a pretty lengthy list. Make sure that's something that you can remember, of course. That kind of goes without saying. But you do need to answer those. You do need to answer all 3. And this is for security purposes, again, because of the sensitivity of the information that you'll have access to. Next is multi-factor authentication. So I&A does use this, again, to secure the information. You can set this up with a phone number. If you do it with a phone number, it will ask you if you want a text or a call. It'll be a code type system. You can also ask it to set up an email address. You want to select a primary. You can select an alternative, and I do recommend that. That's typically a good safeguard. But as you can see here, it's going to give you a drop down of your options, and then you just have to enter the corresponding information based on the selection that you make. It can be changed at any point. So if you select phone today and tomorrow you realize I want an email address instead, you can change that. It can be changed at any time. It can even be changed, an hour later. That's totally fine. What it is going to do though is it is going to send an email confirmation letting you know that that's occurred. And you'll see that anytime you change user ID, or excuse me, change password for your user ID, those kinds of things. You'll get those confirmations. Again, just to make sure you're aware of the changes. All right, so once we're registered, you will get into the I&A system. The home page is going to look a little different the first time that you set up for a new user versus existing. Not much. It's an extra tab, and it depends on your user setup. So I'm going to show it to you as it would look if you were a new user just registering. So this is your initial access, and at the top you're going to have 3 tabs. You're going to have the home page. As you can see here, it's asking you, giving you some tips. It's asking you some questions. Are you an individual provider? Are you responsible for an organization, or none of the above? It's going to give you just some guidance on what to do next or what to expect. Again, you can also see that quick reference guide and the frequently asked questions, those resources that are going to help you along your way. On the left, you're also going to see some contact information for EUS. Now, EUS is going to be CMS, basically CMS's help desk for the I&A system. If you're having trouble with your access and forgot password and user ID, if retrieving your user ID is not working for you, those are numbers that are worth jotting down. They are the ones that are going to be able to help you with more complex access issues to I&A and to PECOS. That's, again, not something that the MACs control. CMS does control that. So we're going to talk about the My Profile page and the My Connections page in just a minute, but I want to show you what this looks like for an existing user. So this is where it's just a little bit different. So your initial access is going to still have the home, My Profile, My Connections. It may also have My Staff if you are an authorized official or if you are an access manager. You're an organization, it may show your staff. Now this is going to be not your going to be your staff that are able to submit applications on an organization's behalf. So they are staff that you can manage what they have the ability to do. This is not, I repeat, this is not going to be providers that reassign to an organization. We are in the I&A system. We are not in PECOS. We are not looking at enrollment records yet. This is purely user ID and password access. The other thing that you're going to see is that you have your pending connections. So if you're an authorized official, you are an access manager, this is where you're going to see providers that are asking to be connected to your organization. Again, not enrollments. We're talking about that business relationship between a provider and the entity before they get that provider transaction access number, that PTAM, and also pending surrogates, so people that are acting on your behalf. This is where you're going to see if you have requests out there that need to be approved or denied or managed. So I'm going to start with what you can do from the My Profile page. This is where you can manage your own account information. So at the top, and I apologize, that image is just a little fuzzy, I know, as I present on a webinar, but this is going to have your name, your address, your contact information, your primary and secondary email. So all of that information that you provided as you set up your account, there is that yellow button that's going to let you modify any of that information. You can also choose a different password. So this is where you can change that password, and you can change your MFA preferences in My Profile. It's kind of like my account in other things that we deal with on a daily basis. The other thing it's going to do for you, and this is for all users, it is going to show you down at the bottom, and you'll see that red box. It is going to show you the employers that you have access to or have requested access to. So the first column, the employer, is going to be that business, that individual, that organization's name that you might have that affiliation with. And then it is going to give you the role that you have. It's going to show you the status, whether that's approved, pending. It could also show canceled. So if it's been deactivated, that access has been taken away. And then the last two columns are fairly important. You see PECOS and MPES, and that's a series of yes/no questions. Anything that says yes, you have access to that for that employer. If it says no, you do not have access. And on the third one, you can see it there. Uh, that third one I've intentionally set up where that this person has access to NPES for this employer, but not PECOS. So if they're having trouble submitting applications or they're not able to see their enrollment information, check here. It could be that that PECOS access has been set to no, and you may need to request that access. And that bottom button is adding an employer connection, and we're going to talk about that next. So if something's missing, something doesn't look quite right, you can go in and request that. So if you're working for an employer and you need to request a connection so that you can work on their behalf, this is where you're going to do that. You'll click on that Add Employer, and that box is going to change, and it'll look like you see on the image on the right, the lower half. What you're going to do is you're going to, at the top, you're going to want to search by the employer. You have a few options. You can look up their name, their MPI. I recommend MPI. That's usually the most direct route, but you have all of those options, and then the search results would show them. It's been removed for privacy reasons here, that's why it's blank, but it will show you which ones. From there, you can actually view other names if there's a DBA that you have to have. It'll also let you select the employer, and from there it's going to allow you to select the role, and that's that box on the bottom, the role that you want to request, which would be the authorized official, the access, the staff end user, and then there's also a surrogate. But you have to scroll down to see that. That's why it's not there. So you are going to select the role, and then it may ask you for additional information based on the role that you select. From there, it's going to go to that access user, that authorized official, and it's going to be waiting for their approval. So this is how you request it, but it's not immediate. It does require that approval. The next tab we're going to move on to is going to be that My Connections tab. Now, we received several questions on how to set up surrogacy connections, and this is where that happens. So this is going to be the Connections tab where you can request surrogacy access as well. Remember that surrogate is an organization or an individual with a business relationship to a provider and they want access to their information. What you're going to be able to do is view and modify PECOS information, submit applications, but you have to request that access. We have my connections and my staff, but again, as I said, CMS needs to keep the identification separate for those that are actually staff users that are employed by that organization versus those that are surrogates. But essentially, they can do the same thing. They do need to both request their access, and they both need that access approved before they can start functioning in that way. That's the biggest difference, is just the tabs that we're utilizing some of that on. But here you can do that same provider search, and then you can, at the bottom, you can add the surrogate, and again, it's going to give you the option of what you want access to. It'll do that on the last page as well when you add your employer. So it's just, do you want PECOS? Do you want MPES? Do you need both of them? Make sure that you're selecting them, and you can select multiple. It's a square box, is a checkbox versus what we call a round radio button in the PECOS world, in the I&A world. So you can select multiple. The round buttons, you can only select one. So if you need to add staff, so this would be where an access manager, an authorized official, can actually add and modify their staff roles. So this is the reverse of what we've been talking about. You're a surrogate, you're a staff member requesting your own access. You have to wait for the approval. This is where the authorized and the access managers can add their own staff without their staff having to ask for that. So they can do a few things here. They can view their staff users so they can see who currently has access, and they can see what their role is and what systems they have access to. And you see here in the image, there's the name, there's the role. It'll be a yes, no to PECOS, it'll be a yes, no to MPES. Yes means you have access, no means you cannot see that information. Again, first thing I would check if you're having challenges accessing information, see if you're set up, see what you have access to, see what your role is. So those authorized officials, those access managers, they can search their staff. They can search it by name or employer name. So if they want to just look for the users in a particular group, they can do that. MPI is not an option here because we're not talking about those medical professionals at this point. They won't necessarily have those MPIs. So they can also modify it. For existing users, they can add or remove access if they need to. If they need to add them to systems that maybe they don't have access to, they can remove staff that's maybe left or no longer needs it for their role. And then they can add new users. There is an add staff button, so they could add those new users. You also have a historical record here. That's what that inactive staff button is. It'll show you those that were there but are no longer. So this is what adding new staff will look like. You'll go into add staff and it will ask for name and email information for that staff, and then it will ask you to select the employer. It'll ask you to select the role. You can promote someone to an access manager, so you do have that option here. And then you do have PECOS and MPI. Checking the box will make that no switch to yes. Oftentimes what we find is someone has access, but those boxes weren't checked, and that's why they can't access the information. Never received that approval. Self-service tools, we did talk about this a little bit already. The forgotten password, the forgotten user ID, and managing and updating your profile. What you're seeing here is what this looks like when you're on that I&A screen and you're an existing user. You do have that information. Again, this is going to be your first step. If your user ID and password are not working, try to recover your user ID, try to reset your password. If that doesn't work, you are probably to the point that you have to call the EUS help desk. Again, that's not something the Macs can do. So some tips before I give you some resources and I check in with for questions. you do need to set up your I&A user ID in order to do anything inside MPES or PECOS. So if you're trying to set up for PECOS, you don't know where to get that user ID, this I&A management system is where you get there. You want to make sure you keep that access up to date, just like anything else. There is a period of time, about 60 days, where it's going to lock your account and you need to reset your user ID and password if you have that type of inactivity. May not be your scenario, but if you do, that's one of the things that can happen. Sign into this periodically, even if you're not actively using it, just to keep those user IDs and passwords active and change them as needed. Now, locked is one thing, disabled is another thing. If you have a long period of time for inactivity, that's going to be, you're going to want to look at those 60 days, but 180 days, but less than 365, that's going to require that password reset. So basically anything under a year is going to be that password reset. If you haven't used it for more, 365 or more days, then you're going to actually need to create a new user ID. At that point, it's not disabled, it is just completely turned off and no longer exists. It's cleared out of that system. So again, keep that access current. And I know with some providers, they're not submitting applications often, which is why you want to maybe set a reminder for yourself just to go in and check things out, make sure things are still active. And the other thing that I've been stressing today that I can't stress enough is that the I&A system does not precipitate any updates into the PECOS system. If you want something updated on an enrollment record, you must submit an enrollment application to do so through PECOS. It does not, the information from I&A does not transfer over to PECOS, and that is intentional. So with that, I have included some resources for you today throughout the presentation, but here in one place. I've given you a link to the I&A management system. I've also given you links to those resources that we talked about, the quick reference and that frequently asked questions. I've also given you information to the to MPES for your MPI and PECOS, along with a link to the CMS provider enrollment information. So you have that at your fingertips if you'd like that. So with that, I am going to check in with Aline to see if we have any questions.
Hi, Leanne. I do have a question in the chat from Nicole, and she says, is there a way to help the authorized official if they have never signed in and the staff user needs approval for reviewing information? Is there a direct phone number or contact that can help the authorized official to set up an I&A?
So to set up an I&A, in order for that organization to get set up to submit through PECOS, if they've submitted through PECOS, that authorized official should already have that user ID and password. If they don't have it, it may be that password reset. You may have to call EUS, but they're not going to be able to approve user access without being set up. In fact, they won't get that notification. Now, if there's been a change of authorized official, that is something you definitely want to keep current so that they have that. They would have signed in at least once, but the other recommendation that I would have is that you have access managers, because we do understand those authorized officials are maybe not actively involved in the user access process after that initial setup, and they've maybe not signed in for quite a long time. I would recommend having at least one other access manager, but I'd have them try their password reset tools, and then also they may need to contact the EUS to help them gain access back in.
Thank you. I do not see any additional questions at this time.
All right, thank you, Aline. If you do,
wait, one just came in. I'm so
okay,
sorry.
no worries.
Literally just as we were talking. Okay, this is from Jasmine. She says, I'm an access manager for our group, and I enter our providers' enrollment applications and process revalidations. Some providers at our group recently created NPIs, and shortly thereafter, I received notification of them sending staff and end user requests. Our providers typically wouldn't have this role in I&A. Is that correct?
So it kind of it's a fantastic question. It depends on how they set themselves up. They requested the MPI, so they had to have MPI access. But so you may see those. What I am suspecting has happened is they checked the boxes for PECOS and MPI. They maybe were unsure. They, instead of just getting the user ID and password, where they'd be able to set up their MPI, and as you said, they wouldn't get that access, they wouldn't request it. They probably went into the My Connections tab and requested it, thinking that they were enrolling, thinking that they had to. So I think that can be solved more with a communication with the providers. They may not, because if they're just asking for an MPI, they're relatively new. They may not realize what they were requesting, and it looks like they went in and they thought that was connecting them to the org, and they don't have to do that in I&A.
Thank you. Sorry for that,
No.
interrupting you.
No, perfect. Thank you for that. Great questions. Now, if you think of any questions after today, feel free to send those to me. I am going to ask Aline to throw our education mailbox back into the chat, and I'll be taking questions for the next 7 days after this event. So go ahead and zap me an email. Again, I will ask that you put in the subject line PECOS Access, getting started with PECOS Access, something related to the title, so that my colleagues know that that needs to come to me for me to get those responses to you. Now, in a couple of minutes, you are going to receive an email that's thanking you for attending today. Don't delete that without looking at it first. It has a few purposes. First, it does have a link to that survey we talked about earlier, because we certainly do appreciate your feedback and we need that to improve and strengthen our education. So I want to thank you again for taking a few moments to complete that. Now, it has that link. You're also going to get a link in the chat for that survey, and then you're going to get a pop-up that is not malicious, it's not spam, it's not taking you anywhere you don't want to go. It's just letting you know that you're leaving our webinar software and going into CMS's Qualtrics survey software. The other thing that's super important here is if you're attending for continuing education credits or would like to use this session to count towards those hours, this is your certificate of achievement. So if you didn't get that, one of two things happened. Either it went to your junk or spam folder because it's coming from our WebEx software, or you attended today by phone and I don't have a systematic way to confirm your attendance. Simply send us an email through that education mailbox. Let me know that you attended by phone, that you need a certificate, and what your phone number was. Once I confirm your attendance, I will go ahead and get you that certificate. With that, that does end our presentation for today. I do hope you found this helpful, and I look forward to survey comments with you telling us how we can help you more in the future. On behalf of myself, Aline, and the entire Provider Outreach and Education team here at WPS, I want to thank you for taking the time out of your day to attend today, and we hope to see you on future events to help you along. With that, you may now disconnect. Have a great day.